May is Lyme Disease Awareness Month. Today I would like to talk to you about 3 points with respect to Lyme disease. The first, what is Lyme disease? The second point is the treatments of Lyme disease, and then last but not least, the awareness and prevention of Lyme disease. Lyme disease is a tick-borne illness, usually carried by the western black-legged ticks or deer ticks, which are endogenous to Ohio, especially to Summit, Jefferson County, and along the east border of the state of Ohio. It just simply means that it is a disease that is spread by a tick. The tick is basically just the vector. Lyme disease is often undiagnosed and is frequently misdiagnosed. Therefore, it is not often treated. And when it is treated, sometimes the treatment is too late. This is a terrible circumstance because when Lyme disease is untreated, it can lead to irreversible neurological conditions, which can slow mental function and cause partial paralysis and severe muscle weakness. It also can lead to severe rheumatoid arthritis of major joints, especially the knees. Treatment of Lyme disease, if caught early, is very inexpensive and very easy to treat. The actual cause of Lyme disease is a bacterium. It's a spirochete. The name of it is Borrelia burgdorferi. The most common antibiotic that is used to treat Lyme disease when caught early is doxycycline. It is usually prescribed at 100 milligrams twice daily for at least a week. And doxycycline, as I'd mentioned before, is very cost effective. It's not going to run you any more than a few dollars, even if you do not have prescription insurance. Other antibiotics commonly prescribed to treat this bug are also ciprofloxacin, 500 milligrams, and I've even seen some dosing of penicillin. But usually a tetracycline derivative is most commonly prescribed. If caught late, the effects of Lyme disease cannot be cured, and we can only manage the symptoms palliatively. And they last and persist for a lifetime possibly. So that is why a correct diagnosis and an early diagnosis is preferred. And thirdly, I would like to talk to you about something that we've all heard before, I'm sure. An ounce of prevention is worth a pound of cure. Lyme disease is a disease that is very easily treated, but as I've mentioned before, it is often misdiagnosed or undiagnosed. And it's such a travesty because the later stages of Lyme disease are irreversible and untreatable. So first of all, let's cause some awareness. You must be aware of a situation where you could experience ticks, such as outside, at a baseball game, picnic. They like to have themselves located at the tips of grass so they can easily get onto your legs or whatnot, or your clothing, and then travel up, and then of course they bite you, and they're parasites, so they suck your blood. So if you know that you're going to be hunting, going to a sporting event, a picnic, or something to that effect, you should just at least have the awareness that a tick might be around. So you should look for them. Look for them on your body daily. A good time to do this is going to be right before you get into a shower. The high season around Ohio for ticks is spring and summer, basically. Ticks don't have a lot of activity in the winter and fall months. So when you're outdoors and you're in a situation to where you may experience a tick bite, you would want to use a repellent like Deep Woods Off that contains DEET in a concentration of 20 to 30%. And these medications that contain DEET are safe and effective for all ages. Now, if you do get a tick bite, You want to remove the tick within 24 hours. This greatly reduces your chances of getting Lyme disease. Now, I wasn't able to find any literature on what percentages it decreased your chance of getting Lyme disease, but all of the websites that I visited, from Medline, which can be found at nlm.nih.gov, to lyme.org or cdc.gov, which is the Center for Disease Control, they did not have an actual percentage of the decrease in chance of that you will get Lyme disease if you remove the tick within 24 hours, but it appears to be a very well recognized threshold to decrease your chances of getting Lyme disease from a tick bite. Hey, so you should also know how to properly remove a tick. You would want to use tweezers, and you want to try to grab onto the head of the tick and pull straight out. Then you would want to apply a topical antibiotic ointment. Please do not try to use any old wives' tales, such as putting Vaseline on it to smother it, or even kerosene, or try to burn the tick off with a match. I've heard a lot of those. They just aren't as effective as getting the tick by the head with a pair of tweezers and pulling the tick out. Now, the pinchers may be left in the skin. The tick will not grow back. That is also an old wives' tale. But the pinchers may cause a little bit of an infection themselves, but it will normally resolve itself within 24 hours. The other old wives' tale about ticks and Lyme disease is that they always leave this landmark, classic bullseye rash. That is only true some of the time. Ticks leave a rash if they have an infection that they have passed along to you. This is quite common with a lot of insect bites. And quite frankly, we live in an area where not only do we have ticks, but we have other insects such as spiders, the black widow spider and the brown recluse, that can leave a nasty bite. So my advice to you would be, if you have an insect bite that you think may be a tick, and it's leaving a rash that is not going away, that is persistent, that is warm, please seek medical attention. Because even if it is not a tick bite, it may be the bite of an insect that is going to cause you some harm and maybe have some tissue damage and that sort of thing. So you definitely need to seek the advice of a clinician. In closing, I would just like to say that please remember that this is National Lyme Disease Awareness Month. It is May, and ticks leave Lyme disease in human beings. If you have a tick bite, please be cautious. And if you experience any of the signs or symptoms that I've mentioned, please seek medical attention. Because treating a tick bite that may carry Lyme disease is very easy if you catch it early. If you do not, it can be very dangerous to your health. The information that I found could be found at the Center for Disease Control. Their website is cdc.gov. The Center for Lyme Disease, which they have a website too, which is lyme.org, and Medline, which is nlm.nih.gov, which is a resource of the National Institutes of Health. I hope this informational video was very informative, and please be safe in the spring and summer months with respect to ticks and your health. Thank you very much. Bye.